special meeting of the Legislative Affairs Committee. I call this meeting to order. Please be advised that FATV is conducting an audio and video recording of this meeting for public broadcast. I ask that anyone in the audience who is recording this meeting to please identify themselves for the record now by standing and state your name and city of residence. Seeing none, at this time I ask that all electronic devices be placed into silent mode. Okay. Tonight we have three items listed on the agenda. However, item 007-25, at the request of the petitioner, has been given leave to withdraw. I would entertain a motion, if that.
Motion to give leave to withdraw.
Do I have a second?
Second.
Okay. Seeing no objection, passes by unanimous consent. We'll take up item 2025, an ordinance to adopt the provisions of General Law, Chapter 60, Section 62A, as amended by Section 89 through 91 of Chapter 140 of the Acts of 2024. Is there anybody here to present on it?
It does not appear so. Do we just hold, or?
Pardon me?
Do we just hold?
Since there's no one here to discuss it,
Motion to hold.
do I have a second?
Second.
Okay. Seeing no objection, 2025 is held. The next item on the agenda is 2125, a resolution by Councilor Cruz and Schultz in support of Massachusetts Medicare for All. The resolution states as follows, as outlined in the enclosed resolution. Do I need to read this? I think I will allow Councilors Cruz and Schultz to present on this. And you have the floor, gentlemen.
Thank you, Madam Chair. Committee members, thank you so much for seeing this and deliberating this today. I also want to thank Patty Healy of MassCare. She's joined us via Zoom to answer any questions you may have. We don't have a formal presentation. We sort of made that presentation last week. And Madam Chair, thank you for attending the Healthcare for All Town Hall. It was really successful. There were probably more people in this building than I've ever seen on a city council meeting in my short time. So it was very encouraging to see, and I had a lot of support. So I hope you had the time. If you were not able to make it, committee members, I hope you had the time to watch that. Thanks to FATV, who have it on demand. And if anybody would like to see that, that is available on demand, fatv.org.
Okay. Thank you, Councilor Cruz. I would like to note that the councilors present this evening are Councilor Kuchar, Council President Zarella, Council Vice President Van Hazinga, Councilor Cragen, and we have Patty Healy on Zoom. I would, if at this point in time, I would invite anyone who wishes to speak to please approach the microphone, state your name and city of residence, and you have 2 minutes to comment.
Switches on the back.
Jacqueline Wetchy, Fitchburg resident. Thank you to Councilor Schultz and Cruz for bringing this resolution forward. In addition to the reasons they and the panelists last Monday gave for it, this will help the working class who earn too much for Mass Health but not enough for the care they need. It will eliminate a big chunk of the benefits cliff and incentivize work rather than welfare. People will no longer enter or stay in bad marriages for insurance. This will provide justice to U.S. citizens by giving them the same benefits that migrants get for free. This will control a significant driver of inflation. This will enable people to retire before they are eligible for Medicare, opening up jobs for younger workers. People will no longer need to ration care due to out-of-pocket costs. This will especially benefit seniors on fixed incomes. Those who do not like the program can purchase supplemental insurance, as is done in the UK. I know conservatives and libertarians are skeptical of government-run health care, but we do not have a free enterprise medical system. The government already regulates the sector so highly, and there is so much consolidation in it, that true competition does not exist. It is like Unitil.
Thank you.
Madam Chair, I did have one other thing to add that I wasn't planning on speaking, but I don't know, committee members, if you've been on your email today, we've got about, I don't know, how many hundred of emails from city employees today regarding the crisis that the city of Fitchburg is in regarding paying for health care and the sort of the unstoppable force meeting the immovable object. We are headed to a collision course and a very serious crisis in this city in regards to how we're going to pay for our health care. And I fully acknowledge that this bill that we have the resolution in support of is a incredibly steep hill to climb, but nothing great was ever easy. It's very difficult to earn, and I think it's just one more step up that steep cliff to accomplishing what is right, not only morally, but what is in the best interest of the city. And I hope that you have a lot of questions for me and for Councillor Schultz, and I hope we can answer them with help from Patty Healy. And I'll switch over to Bernie.
I just wanted to mention some of the people that will be helped by universal health care for Medicare for All. The residents will receive a health card, and they'll get full range of benefits, and they can pick any doctor or hospital. Families of middle and low-income earners will take home more of their income, and medical bankruptcies will be eliminated. That's a big thing for a lot of people, is medical bankruptcies. And for businesses and municipalities, they'll pay a stable payroll tax instead of rising health care premiums. Unions won't have to bargain for health benefits. Everyone will be covered. Instead, bargaining will be focused on pay, workplace safety, and other issues. Seniors will receive more benefits than currently offered by Medicare, and there's a lot of people out there that don't realize that seniors pay that in 2025 $185 a month for Medicare. That is not a free benefit. And a lot of them will get, some of them don't have dental, vision, hearing aids, and long-term care, which will be part of the program. The last thing is poor working class communities, particularly communities of color, will be less likely to experience loss of services and facilities due to marketplace maneuvering. This past Christmas, I met former Councilor DiMartino at Big Lots, and she was buying pillows and towels for the working class poor in the city. Mm-hmm. She does that every year. So there's a lot of benefits for this program. Thank you for your time.
And I don't know if I saw some of the outreach that we did already. Economist Gary Friedman from UMass, my alma mater, go U, he did the financial analysis of what this program would save, and with the city of Fitchburg in this model would save $19,649,941 in the first year. That's money for our police, our fire, our teachers, and our roads, our infrastructure, which, as everyone knows, is in desperate need of added revenue. Thank you.
I have the figures that Councilor Cruz was talking about. It's for all the Massachusetts towns that was left behind in the reading. So I have copies for everyone.
Yeah, I guess Councilor Schultz and I are just hoping and asking to keep an open mind here. I know that there's a lot of misconceptions about single-payer health care and a lot of campaigning and money up against this cause from insurance companies and private equity who benefits billions and billions of dollars off of sick people every year in this country. And it's time to take them out of the equation and to take care of ourselves with community health care. I mean, we just saw our maternity ward close, just last year in Leominster, and that was because they needed more sustainable revenue in Worcester. I mean, this is happening all over the country. It's happening all over the Commonwealth. And I know a lot of individuals have come forward and said, fix Fitchburg's problem first before you start messing around at the state level. I think we can do both. And I don't know, Patty, I don't know if you have anything to add.
Before we go to Patty, what I'd like to do is maybe read the resolution so that people at home know what we're talking about.
Of course, great idea.
If that would help. So this is a resolution in support of Massachusetts Medicare for All. Whereas access to health care has become one of the biggest political issues of the day and is of great concern to ourselves and our neighbors. And whereas the U.S. remains one of the few countries that does not provide universal, publicly funded health care. And whereas the cost of health care keeps increasing, thereby creating a burden and a concern to us all. And whereas the number of people who do not have affordable access to quality health care increases, the health of our communities decreases. And whereas the cost of health insurance increases and the policies include upfront costs of copays and deductibles that are a burden for employers and employees. And whereas in particular, the money spent by cities and towns to cover their employees is a burdensome cost to both the employer and the employees. And whereas these funds could be better spent to improve the overall quality of life and to increase wages and salaries and other benefits. And whereas Massachusetts has been a leader in providing coverage for quality health care for its people, and whereas there is an alternative means of providing health care for all that also provides better coverage without copays and deductibles and includes medical, dental, long-term, and preventative care. And whereas an act establishing Medicare for all in Massachusetts creates that alternative and has been introduced in the legislature as HD 1228 and SD 2342, and whereas this act would save the city of Fitchburg an estimated $19.65 million in the first year alone, therefore be it resolved that the city of Fitchburg endorses an act establishing Medicare for all in Massachusetts and will communicate its support to our state representative and state senator. All right, and that is the resolution. I leave it to the council for if you have questions. Would you like to, I think we have Patty Healy on Zoom. Would you like to speak, Ms. Healy?
Hi, yes, sure. Is my audio okay?
I can hear you just fine.
Great. So, yes, I'm Patty Healy. I'm a registered nurse. I'm on the board of MassCare. I'm also a member of Mass Nurses Association, and I might say that the Mass Teachers Association and Mass Nurses Association have both supported the concept of single payer for decades and supported the effort with their dues money to actually, fund the organizing. I wanted to correct one misconception that was raised, and that is healthcare in a single-payer system is not government-run. It only means, single-payer means it's a financing system that is actually government-run. But government-run in the sense that there is a trust that has a board of people who are either in our bill appointed by the governor and Health and Human Services. We had hoped that it would be even more democratic and be elected, but that would violate our state constitution, so they would be appointed members. The financing system is what would change, eliminating health insurance companies and creating a huge amount of savings. The hospitals would remain intact, although they might say otherwise. You still would be able to have your doctor, your hospital, your healthcare providers, all of those things stay intact. The private systems can stay intact under a single payer system. It's the hospitals will not be run by the government. They will be funded by the government instead of by health insurers as a middleman between you and your provider. I think that's probably one of the most important things to understand about this system is it's the financing, and it's funded by our taxes. It's funded by the revenue that we would get otherwise from Medicare, Medicaid, the VA, CHIP, and those systems, there are single-payer systems that would pay into it. Medicare is a single-payer system that isn't really run by the government. The financing is, but your health care is given at your hospital by your doctor. Same with the VA. If you're a veteran, you have access to a very fine system of health care. It's funded by the government, but it's and by our taxes that go to the government. But veterans can use both the VA and private health care. I think that's a fundamental point that we sometimes fail to explain a little bit more. But I'm open for any other questions. And I think I would like to remind people that this is a resolution to support a concept that we've been fighting for many, many, many years in Massachusetts. And many states, in particular Vermont and California, New York, have actually developed concept and moved it through their legislature, all the way through the legislature. And usually there's, a serious political contingent that sabotages it in the end. But those single-payer movements have enjoyed very significant support among the electorate and the communities in the states. Thanks.
Thank you for that clarification. That was I misspoke.
Council President Zarella.
So I have one outstanding concern regarding all of this. It's my understanding that the primary funding for the increased expenditures will be a payroll tax, correct? So I guess I'm
Is
just...
it also... I'm sorry. Finish your question and then...
I guess my concern is I just want to make sure that we have at least reasonable certitude that the savings for small businesses on insuring their workers will exceed the increased amount of payroll taxes, because I see, despite my own conservative leanings, I've had conversation with the two sponsoring counselors, I see a lot of value to this for reasons that I'll get into in a minute. But I never want to be the one taking a vote that's going to, even indirectly in the case of a non-binding resolution, that might harm our small business community, because I feel that's the lifeblood of our local economy, and I don't want any business here in the city of Fitchburg to see this bill pass and then all of a sudden find that they can't keep up with the increased taxes, and then their employees may have health care, but if they don't have a job because their business just closed, we've harmed them more than we've helped them. So I guess there isn't really a specific question there so much as just, what can you tell me about that? How sure are we that this will be at least generally net neutral or net positive for businesses? Or at least for small businesses. I'm less concerned about, national corporations and whatnot. I care about the ones here in Fitchburg.
Thank you, Counselor. I will say your question comes up often, and we debate it and go over it over and over and over, because in cities and towns like the one I live in and Fitchburg are places where the fundamental building blocks of our economies are small businesses, right? So we want to ensure that they survive and they do well. But a couple of points. One is that for both for any business, the employee tax and the business tax, can't think of the words, I'm sorry. There's an exemption for each tax, a $20,000 exemption. So for businesses that make a very, very low profit margin, they're not taxed on the first $20,000 of their revenue. Businesses that have very small businesses, most of them have owners who already pay for health insurance for their families, which is upwards around between $20,000 and $25,000 a year now for an individual family. They won't have to pay that anymore. That will be gone. So we're talking about a small business with 3 or 4 employees. There's already likely about $25,000 savings for them before the tax is placed on their profit. There was one question that did come up from Councilor Cruz about employers paying $388 per employee, and I just wanted to make sure that was corrected there. They don't pay a fine per employees if they don't pay for health insurance. That went away a couple of years ago. Employees do pay a fine, and it will be increased in 2025. So in this state, they'll be paying more than they did last year if they choose not to have health insurance. But in Massachusetts, we do enjoy having most of our residents be insured. I think it's close to 97%. They say 97%, 98%, something like that. We have a CPA who's on our board and who works with us and goes over a lot of the small business questions. And I spoke to her again today about it. She says even with businesses with just 3 to 5% net income, their labor, and with just a few employees, their labor costs are probably about 30% of their revenue, of their sales. The calculated cost to them would be probably 2% of their sales, the calculated cost for single payer. But the added savings would be the enjoyment of free health care, no-cost health care for the owner. And that's significant in these very small businesses who only have 2, 3, small, like, the local plumber that just 2 guys run the company, or, small electricians, little diners, or small mom and pop places that have just a few family members. Those are the ones who are most worried, and probably, unless they're barely getting by and not really running a business very well, they should do fine. That's what we expect to happen. And just to reassure you, Dr. Jerry Friedman is an economist at UMass, and there have been others in other states as well, and he goes over these figures every single year with a fine-tooth comb, and the way he explains it in his many, many presentations is he always gives us leeway in his figures. So they're not exact figures. There's always a little bit of a cushion. Even when he calculates the amount of savings, there's sort of a cushion in there so that it's not inflated. But for the most part, most communities, there are a few communities who won't save because of their own economies, but most communities will save, and most people who are either working class or middle class, like myself, who will save money and who will enjoy a better standard of health care.
Does that answer your question?
It's hard to give you exact numbers because we don't know until it happens, right? We don't know how expensive health care will be. What kinds of factors will affect our small businesses in the next 2 or 3 years? We know inflation's already going up. We don't know some of those things, so we can't guarantee. But
sure, no one has a crystal ball.
Right. Wish we did.
Oh, believe me, I wish. No, thank you. That is helpful.
You describe yourself as on the conservative end, and that made me think, when we've done our non-binding ballot questions, and it's about 67 communities. They have been in communities that have voted overwhelmingly for President Donald Trump. And I would describe it as a generally conservative electorate. But those communities vote in the same numbers in favor of having a single-payer system as less conservative communities. Mm-hmm. So we don't think of it as nonpartisan. We think of it as nonpartisan. We used to be worried about that because so many people would describe single-payer as something that was sort of like way out there, socialist, European, all these things that would be considered partisan. But our electorate is telling us that it's not, that they want health care regardless of where they sit on the political spectrum.
Okay, thank you very much. Does that answer your question?
That answers my question. I have other remarks, but I'll yield the floor for now and wait and see if anyone else has anything to say.
Okay. Councillor Van Hazinga?
Thank you, Madam Chair. So I applaud the idea of expanding health care. Sorry?
Nope.
Okay. And I think it is a good and it's a needed thing that we need to do. I think there's a great problem with making sure that healthcare is not right now it's not equitable. It's not available to everybody. And we do need to do something to address that. But I do have some significant concerns and questions about how this would operate and if it's feasible. And I guess I'll, since we have an expert here, I'd like to ask some questions. I'll start with a more specific one, then get more to my vague questions. But first, in Massachusetts, we're a net exporter of healthcare. That we have some of the premier hospitals in the world in Boston, and we have people who come from all over the country and all over the world to get medical treatment in Massachusetts. How does that affect that pattern of people coming to the state to receive health care and these ability of these facilities to offer world-class healthcare institutions that cater not just to residents of Massachusetts or New England, but the whole world?
That question's been asked before. We don't believe that the quality will change. We do believe people from other states will continue to want to use Mass General and Brigham and Women's and BI Deaconess. But they will be billed. If they have health insurance, they'll be billed. Their health insurance company will be billed. Or if they have a single payer system or they have the VA, those systems will be billed. So we'll still get the revenue for the care that we deliver. They'll still be able to use the system, but they'll have to pay for it. They won't enjoy what Massachusetts enjoys. And I might add that there are many people in the healthcare financing world who think that if one or two states moves in this direction, then the others will very quickly fall in line because the benefits will become very clear. So I think that will happen. But just another thought about Mass General Brigham. You know, one of the problems in our state, which is we have many, many hospitals in the Boston area. One of the problems is that it's concentrated in the Boston area, and it's accessed by, like you said, people from all over the world and people from other states, but our own citizens can't access it because they can't pay for it. And one of the biggest drivers of the healthcare cost are these very expensive hospitals that charge high prices. Some of them are nonprofit. We have some for-profits, but Mass General Brigham can get 100% more money for a test than UMass can, or Leominster Hospital or Cooley Dickinson Hospital. These inequities, this profit mechanism is what drives these costs, and then they are also very heavily integrated with insurance companies. And some of them run their own insurance companies. Bay State Medical Center does. Mass General Brigham does. They have multiple insurance companies of their own to ensure that they can continue to bring in profit and really crush the smaller hospitals. So they will exist, and we'll be able to use them, but we won't be driven into incredible debt by using those hospitals.
So medical facilities in Massachusetts can continue to accept health insurance as long as it's from out-of-state residents. Is that that's part of the bill?
Yeah. So if workers are from other states and their employers are paying the tax to our state, they'll be able to enjoy the health insurance without an added cost. The health care without an added cost, just as we do. But other anyone else who uses our system, should it be a single-payer system, will still have to pay. Well, just like anywhere else, we have to bill them because they're not paying the tax. They're not paying for the cost of health care. We will be, because we'll be paying for it through our taxes.
Okay.
No one will be denied. No one will be denied. If that's a concern you have, denial is not in this picture here.
Okay. I'll move on. I think just to my main concern is this all affordable? Is this possible? So, because what we're proposing is to greatly expand the provision of care with the elimination of deductibles, means to deny care that's necessary, and we're really limiting the payment just to this payroll tax. Have there been numbers done that actually show that the amount going to be raised through this tax is sufficient to pay for an expansion of care on the likes of which
Right.
is proposed?
So I can only tell you what our economist has studied and given us for numbers, but what they have done, the economists, is they say that in the first year alone, healthcare spending would be lower than any other year, and that the savings would be about $48 billion. I mean, we're talking about massive, massive savings, because right now the health insurers and the administrative costs of health insurance companies and the CEO salaries and the inflated costs are what we're paying for. That's where the savings will be. Some savings, the $11 billion of the savings in the first year would be able to be used for the improvements in the hospitals alone. But yes, some of the calculations are based on how much revenue we would get from the taxes in the moment that that study is done. What will happen in 2 years? How many more residents will be here? How many businesses will be operating here? We don't know that, so we can only know what's in the moment. But all of the calculations from our economists have shown that we would be able to have a significant savings. And we're talking about municipalities, individuals, hospitals, delivery systems, savings everywhere. I mean, the waste in the healthcare system is massive right now. And I would remind you that other places in the world have much cheaper systems. They pay much less per person in their single-payer systems. And there are about 39 other countries that have better outcomes than the United States does. There are many other countries that have a standard of living, not a standard of living, I want to say the mortality rate. The mortality rate is better than what we have. We have one of the worst maternal child health mortality rates in all of the developed nations in the world.
Yeah.
There's no reason for that. We don't have a system that's taking care of people. It's taking care of somebody's money. So no matter what we do, it can only be better. I guess that's what I want to say. There will be a savings, and there have been professionals who have done these calculations and done this work, and not just Jerry Friedman. They've been doing them in other states as well, but I can't really speak to what their numbers are and what kinds of savings they would see. In our state, the most expensive state in the country, the most expensive health care in the world is in Massachusetts. There has to be savings.
And to piggyback on that a little bit, Counselor, you mentioned that, how are we going to, is it sustainable? Is this new model sustainable? I would argue that the current model is far from sustainable as it is. And Patty can help me out here. There was a comment during the town hall. I believe that the average administrator per patient is 1 per 1. So one administrator per patient handling all the money and figuring out who gets all the money, essentially, doing the paperwork. And I mean, could you imagine if we had, this is a hypothetical, if we had a nurse per patient? I mean, that's what we should be striving for, not an administrator per patient.
Mm-hmm. Mm-hmm.
So, as Ms. Healy mentioned, this only tackles one half the equation, just the payer source, not the providers. And the idea is that the potential savings from taking the profit and reducing the administrative burden on the payer side is enough to cover an expansion of care. How will this affect the provider side? I mean, what ability will we have? Because during the presentation, there was one slideshow or clip in the slideshow that was put up that was listing the CEO salaries of all the healthcare systems that are very high. But this doesn't affect that. How, as far as I can see, how does this affect the profit on the provider side? Because if you look at the national health system in the United Kingdom or the Canadian health system, they cover both sides of the equation. They provide the doctors and the hospitals as well as the payer source. So is this just going to be a way where one side, the healthcare system just still gets rich and takes all the money? It's just the hospitals and the doctors that are doing it instead of the health insurance companies. I mean, how do we equalize that part of the equation?
I'm not sure I understand your question, but I think there are the providers, if you're talking about providers, the doctors, fundamentally, the doctors will continue to be paid very well and can still negotiate their salaries. They will get paid less. They will not be making millions of dollars a year. Not that all doctors do. A lot of them don't. Obviously, pediatricians don't. Mental health professionals don't. But they will be paid a fair wage. What the doctors who support single payer, what they say is they want single payer because they will no longer spend a huge amount of their time doing prior authorizations, having an insurance company decide whether or not their patient can get treatment or not. They will be able to prescribe a medicine knowing that their patient will get the medicine, rather than having to look through all of the different paperwork in a particular health insurer and find out if they actually cover the medicine. Right now, doctors have to wade through an enormous amount of paperwork and decisions, and they might have patients they might have like 15 or 20 different insurance companies that they have to deal with. So their work is going to change. They won't have to do that administrative work. They'll be able to be a doctor, which is what they want. And the Mass Medical Society did some surveys of Massachusetts doctors, and they were pretty much very concerned about how insurance companies have taken over medicine. And definitely like in the 60% to 80% prior authorizations were the biggest complaint they had. And those are imposed on them, and it takes away from the way in which they can care for their patients. Unions can still negotiate union contracts just like they do in other countries with single payer systems. It doesn't mean there's going to be absolute flat wages or that there'll be inflated wages. It'll be the same relationship between nurses unions, workers unions, and employers. That will still happen. But the fundamental thing to remember is that money will not be flowing out of the system into the pockets of people who live in Connecticut and the insurance industry. I mean, that's where the money is going. Instead, it'll stay in the communities, in the community hospitals. It'll stay in the state.
Okay, so
Can I guarantee you how money is going to move around? No. I mean, this is a concept. This is a bill that legislators have been pushing for years. A lot of these little pieces, they're moving parts. I think some of it will change, but I can't say what it will be because that will happen with our legislators. They will decide. They will be the deciders about how this bill would actually be written.
okay, so the potential savings are not just from reduction in the administration of the healthcare insurance providers, but also the healthcare providers not having to categorize medical care and deal with it. Okay. So this would likely require an expansion of the administrative burden on the state to manage care. Is there an estimation about how big that would be, or are we just replacing one administrative burden with another, or how do those?
It'll be markedly less burden. Right now, just as I said, there are dozens and dozens of health insurance companies. Every doctor, your doctor has a full staff who just deals with health insurance companies. They won't have that staff anymore. They will not have to pay people to do that work, to call insurance companies to process billing. None of that will happen under a single payer system. There'll be enormous savings in a doctor's practice. But the state will also have just one system to work with. And right now they have Medicaid. They deal with CHIP. Our state of Massachusetts has one of the most expensive healthcare systems because we fund healthcare. That will go away. what happens is that there are all these other single payers, like Medicaid and Medicare and VA. The federal government has to waive the way in which they do their payments. They'll have to send their payments directly to the state instead of sending the payment to the hospital or to the doctors or whomever. And I might mention that there's a belief that we could save a significant amount in fraud payments as well, because there will only be one payer. There'll only be one place where money will move to. Right now, Medicare and Medicaid are billed by multiple people. And the incidence of fraud, it's between 8 and 15%. It's not really clear. I guess no one really knows. We don't know how much fraud there is. We know there's fraud. But that incidence of fraud will go down because we'll just have this one payer. But that's a system that will be designed by the state, yes. But it's not a system that hasn't been done before. We've had a Medicare system since the 60s, and we've had insurers that have developed massive systems since the 70s and 80s. So it's not like a new concept. The platforms are going to be similar, but there won't be so many of them.
So does this depend on the willingness of the federal government to redesign their payment programs like Medicare, Medicaid, VA, all that, to work with the proposed system in the Massachusetts?
It's just, there's been a bill filed every year. They do the same thing happens. Is on the federal side, bills are filed to enact a waiver. So these bills are filed that say, in the event that a state begins to have a single payer system, we need to set up a waiver system so that payments will go into a state trust, one bank account, as opposed to many others. It's just a different way but the federal government has to say, yes, we're going to do it that way.
Do you think that this system is workable without the federal government agreeing to that?
Well, no, I don't, because if they don't do it, then we can't, Medicare can't participate. Seniors wouldn't participate. They'd be denying seniors ability to participate. I think our citizens would be outraged if they couldn't participate, because they clearly want it.
Okay. We'll give any other councilors the opportunity to talk.
Councilor Kuchar.
Madam Chair, I do not have any questions. I just have some comments, so I will reserve my comments until that time.
Councilor Cragen, do you have any questions?
I do not have questions, just a couple of comments.
Okay.
I have a couple additional questions.
Go ahead, Council President Mazzarella.
Thank you. So I understand most of what you're saying makes sense, but there are 2 points that I'm not quite sure click for me. One is I'm not sure I see the elimination of the potential for fraudulent billing, because maybe there's only one person, the state, billing Medicare and Medicaid and so forth, but you've still got all these individual providers billing the state. Doesn't that just move the potential for fraud from one payer, Medicare, Medicaid, to a different payer, the state, where you might see the same people who are trying to defraud Medicare and Medicaid right now instead submitting fraudulent bills to the state for reimbursement?
No, I don't. No, I really don't. I mean, I think that's I beg your pardon, but it's a little bit nitpicking. I brought up fraud because fraud exists. We know it exists. And this is a system that has been proposed that will decrease fraud. Can I tell you all the ways in which that would happen? No, I can't. I can only tell you what the professionals have told me. But I don't think it will increase fraud.
I'm not saying it will increase fraud, and I'm not trying to play the sort of perfect solution fallacy and say if this doesn't solve everything, then it's a bad idea. I just want to be clear about what benefits we can expect to see and what benefits are maybe a little bit more speculative or more hopeful rather than concrete. And that leads me into my second question, which is in terms of the bureaucracy, in terms of the prior authorizations, all of that stuff, I forget what they call them, the list of approved drugs and so forth.
Formulary.
Formulary, thank you, Counselor. I guess I'm not sure I see necessarily how this would eliminate that either, because the way I see it is the state has two choices once the state is the payer. Either it doesn't implement any cost containment measures and just approves everything that doctors send to them on the grounds that, well, the doctor says it's necessary, so it's necessary. And then I could imagine this very quickly ballooning out of proportion of our ability to pay. Just because, I mean, there's oversight in every system for a reason, right? But then the other alternative is they do implement cost containment measures, which I imagine would inevitably look at least somewhat similar to the cost containment measures that are currently in place with insurance companies. And again, I'm not trying to say if it's not perfect, it's not good. I'm just saying why do we think that the state itself wouldn't be essentially compelled by practicality to put some of these same bureaucratic restrictions in place for their billing? To say to a doctor, okay, justify to us, the state, why your patient needs this procedure. Why do we think that would go away?
Well,
The trust, okay.
Go ahead, Patty, go ahead.
Yeah, so the way the bill is written, a trust would be established with the medical professionals who would decide what the standards of care are. Mm-hmm. And the bill outlines where those professionals will come from, as well as other state officials. The state it's in its best interest to save money. Mm-hmm. Right? The current system is in its best interest to make money. They're completely different things. Right now, we have a system that takes money out of the state. This system will keep the money in the state. I mean, it's the motivation for the state is to save money. And right now, there are systems, there are several organizations run by the state that are attempting to rein in costs. They failed every single year, and they admit it. They say, oh, we've told the insurance companies they have to cut back. We told them to set goals. I attend some of these meetings. They fail because there's no way. You can't tell private business that they can't do what they're doing. I mean, the only way we can change the system is to create something that they can't necessarily profit from, and so they won't want to be there. Look, all I can say is there are people who are running hospitals right now in this state who support a single-payer system. They know it's to our benefit. There are many legislators who support it, and the reason is we need a better system of care where people get healthy and get better and are not in massive debt, and they can see the doctor they want to see. Right now, we don't have a system that works. We have a system that has spiraled out of control, that is no longer delivering good care, that has driven nurses and doctors from the bedside, that has created enormous profits, has closed down hospitals. 8 hospitals in our state were closed down by Steward Health Care. We can't stop Steward Health Care, right? Unless they no longer have an incentive to be here. And a single payer system would do that.
Thanks.
Fair enough.
Thank you,
That
Patty.
answers my question.
I think that was right on the head. Just to add one more small comment regarding sort of the things we put in place for cost saving and efficiency. I mean, you take a look at what we pay for even just prescriptions. I mean, it's 5, 6, 7 times what other countries are paying for the exact same medications, because we need to, or the insurance companies and the drug companies, they need to enrich shareholders, right? This system, it would be about care, and doctors deciding who gets the care, the quality of care they get, and what they need, and not insurance companies who are driven by profit. That's just a little point to add to that. And yeah, go ahead. Sorry.
No, that's all set. I'll hold comments until everyone else has started commenting, and I'll yield the floor.
I have a question. I have a couple of questions. I guess in all of what we've been talking about so far, no one has said how much this is going to cost. And my question is, we have a 7.5% tax on employers for businesses under 100, 8% for people businesses 100, I think 100 and over, 2.5% for employees, and then 10% for self-employed. What happens when what we're spending is not covered by that anymore? Do we change the percentages? Do we cut back on services? How do we know up front? We're being told, well, the system that we have right now doesn't work, so anything has to be better. Well, that's not true. There can be things that are far worse than what we have right now. So I rather than jumping off a ledge and saying, geez, I hope there's a mattress at the bottom, I would like to know whether there is something that's going to stop my fall. And so far, I have not heard any numbers. I've heard promises. Well, we know. Well, this economist said that it's going to work. Well, there might be 10 other economists who say it's not going to work. And I guess I'm just not convinced that this, in its current state, isn't a bit of pie in the sky. Let's all, vote for Medicare for all. And if the federal government has to go along with this in order for this to happen, I'm thinking that in the current climate, that may be a hill too steep to climb.
That's a really fair point, Madam Chair, and very kind of you to call the mango megalomaniac the current climate. That's a good way of putting it. Patty, do you want to answer that?
Yeah, a couple of things. Well, right now, according to Jerry Friedman, the current system costs about $125 trillion in our state. And a single-payer savings, he said, would give us a $48 billion in savings from what he calculated, using the cost of health care right now, the current spending, what the tax revenue would be. And that would leave about $11 billion in savings to actually improve our system. The other thing that we can do in any single-payer system is to negotiate lower drug prices. The VA pays a fraction of cost for pharmaceuticals right now that we pay and that hospitals pay in our state. We would have the ability to actually negotiate that because we would have a massive amount of people who use pharmaceuticals. So negotiating drug prices is significant. Negotiating with biomedical companies is significant. Those are presumed savings. Can we make? I can't make a promise. I mean, there are no promises. There's only data that has been produced, and I might say, I haven't read of any economists who've said this wouldn't work. There have actually been think tanks, conservative think tanks, that have studied this single-payer system and came up with reasons not to publish because they found that, in fact, a single-payer system would work and save money. It just wouldn't make money for investors. And right now, healthcare is one of the premium places for investment firms, for Wall Street to invest. They're investing in nursing home chains, hospital chains, biomedical chains, pharmaceuticals, and they're making money in it. A single-payer system wouldn't allow that to happen. Now, we're asking you to consider a resolution to look forward to a future without healthcare debt for your children and for us. Right now, we are in debt. There are proven ways in which these systems work. We already have them. The VA already exists as a single-payer system. Medicare already exists as a single-payer system. It's not like it doesn't, we've never seen it before. Medicare actually has a very small overhead compared to all other insurers. We know that it can work and it can be managed. We know that people want it. We know that polling has shown us through our balloting in Massachusetts that people want it. If you don't, as a group, as a city council, you choose not to endorse this resolution, it's not going to hurt either way. There are cities and towns that do, there are cities and towns that don't. This is an opportunity to generate discussion, to generate education, to have municipalities appreciate what is really at stake in the future. And it's fine to say, oh, this isn't going to work for us, so we'll think about it another time. But I think it's important to realize that there is a realistic alternative that has proven to work in other places in our country, and that Fitchburg in particular is in a very difficult place right now, is struggling to meet its healthcare payment need. I think it's worth a hard look. You can think about it and see about how other towns and cities handle this, and have these conversations. But if a few cities and towns approve a resolution, it's not going to change anything in terms of the bill passing. It's really going to be the legislature. It's going to be who you talk to at the state level. It's going to be who is really going to have the courage to make a fundamental change in financing so that people can have equitable, low-cost health care. It's not happening anywhere unless we look at these reasonable alternatives. And this is a proven system. We use it. We have it in our country. It's also used heavily in the rest of the developed world in other countries. That it can work. We know what the pitfalls are.
Okay,
I think
thank you very much. I think you've answered my question. Questions? Additional questions from the committee? No? Did you have a comment?
Yes, one more, Madam Chair, if that's all right. I want to again thank Patty. I don't think I can put it any better than that. I think she hit it right on the head. I want to thank her for coming today and for having this conversation with us, and for you for having this conversation. And the last point I'll add is, people throw around the word socialism a lot when it comes to single-payer health care. Under that argument, the fire department is socialism. The police department is socialism. Your teachers are socialism. That's how we've always done things. It's just the model in which we take care of each other. And I thank you for considering this model as a means to take care of one of each other and to serve our residents. Thank you.
Okay. Thank you, Ms. Healy. We appreciate your comments. We have no more questions, but I think that Councillor Kuchar hasn't spoken yet, so we'll let Councillor Kuchar make his comments, and then if Councillor Cragen has comments, he would be next. Councillor Kuchar?
Thank you very much, Madam Chair. So I had a nice conversation with Councillor Schultz in regards to this non-binding resolution, and he asked me to do one thing: keep an open mind. Now, like Council President Zarella, I have conservative leanings. I was extremely doubtful in regards to this single-payer healthcare system, and I still am. There's nothing here that that I have heard that would cause me to change my stance. They're citing $48 billion in savings, and being a small business owner, I would bear some of the burden of as the employer of 8%. My employees would have to pay 2.5%. Now, I remember these discussions were very similar back when they were throwing around the term Romney Care, and which eventually led to Mass Health. Now, what has Mass Health done? Now, Mass Health has done some good. I'm not going to say they haven't. You know, we now have a population that I believe the percentage was 97% are covered. What else has it done? People are wondering, why did Burbank close? Why did the birthing center at Leominster Hospital close? Why is Neshoba closed? Now, our area has a very high concentration of Mass Health recipients, which it is what it is. But they pay 20 to 30 cents on the dollar. I know that because I have to deal with Mass Health when I'm dealing with a Mass Health lien, you know, after an auto accident or something like that, or after some personal injury. It's unsustainable. And I see this as just another Romney Care. Now, they're saying, well, it's going to take the bureaucracy out of the insurance and put it in the state. Like we don't have a bureaucracy problem at the State House? I just don't see this working. Now, Councilor Cruz, you said check your email. I did. I've been checking it all afternoon because I think I've gotten about 250 different emails, all with a resounding no.
That's actually not in reference to this. That's nothing to do with this. Well,
Yeah,
Okay.
It's in reference to the.
You're actually making our point. The current system isn't working.
Oh, I agree the current system is working. Isn't working.
These are comments, not questions from.
Of course, Madam Chair. I just wanted to correct.
But the emails that I got were all a resounding no. And because I'm getting them right before our hearing here today, I think most of the people that are emailing is in direct response to what we're here for today. And whether or not it is or not.
No, it's not. It's
Okay. Well, if that's the case, then that's fine. But all the emails say one thing. This would undo decades of work. I urge you to vote no when it comes to, when it becomes before the council. And that was from a Fitchburg resident. Okay, people don't want to bargain with their health insurance. Now, they want to say that, you know, this is going to be a big savings. I just don't see it. I really don't. And unfortunately, I'm going to have to vote no on this. I wish it would work because, yes, we do need to revamp our healthcare system. I just don't see this working. Well, thank you.
Point of information, Madam Chair?
Yes. Go ahead, Council President.
I just did want to clarify, I've gone over those emails as well.
Yep.
They're in reference to the PEC issue that's coming up on our current agenda to be referred to legislative.
Thank you for clarifying, but that does not change my vote.
No, that's fine.
Nor
Just
my
wanted to
opinion.
clarify the information.
Thank you,
Mr.
Council
President.
Zarella. Councilor Cragen.
Thank you. We're over time, so I'm going to keep it brief. Patty, thank you for your information. I think about this matter a lot, having been a freelancer my entire professional life, and having been grateful when Romney Care did come in, because I've been a freelancer for a long time, and this line, we don't have a system that takes care of people, we have a system that takes care of money, is what's ringing in my ears. I'm a resounding yes. Yield the floor.
Thank you.
Council President Zarella.
Thank you. First, I just wanted to briefly, and my apologies to my colleague, push back on one point, just because it's one I hear very often, and on principle, I feel like I have to address it. I think there is, in terms of the claim of socialism, now I'm not saying this is socialism, but I do think there's an important distinction to be made between common goods and public goods. Something like the fire department is a common good. It's something that's used by everyone equally, as opposed to something that is given to each individual on an equal basis, but not necessarily in an equal fashion, because everyone needs different health care, everyone has different needs, and so forth. Socialism tends to involve the state taking on the burden of public individual goods, whereas the government providing for the common good is just a function of government itself for as long as government has existed. It's not really distinctive to socialism in any way. That's kind of a sideline, though. I just wanted to address that very briefly. When I first saw this resolution, I admit, everyone knows where I stand politically. My first reaction was, really? But having looked at some of the data, I'll first say I share my colleague, Councillor Kucher's concerns about feasibility. The state has a massive bureaucracy problem already, and I doubt not the ability of a government in general, but specifically the ability of our government in the state of Massachusetts to administer something this significant in an efficient manner that doesn't either let costs snowball out of control or alternately just re-implement the same kinds of crippling bureaucracy that we're seeing currently. That being said, I think that with more polish, with more thought put into this, with more troubleshooting, essentially, I could support this because, and you can mark it in your calendar if you want, I'm a free market guy, but I agree with Ms. Wetchy. We do not currently have a free market in healthcare. We have a massively overregulated market in healthcare that leads to what essentially is a government-granted oligopoly in health insurance. There are two possible solutions for this that I see. One, which would be my preference, would be to massively deregulate. But again, we're in Massachusetts. I'm a realistic person. That's not going to happen. The other alternative is to cut the Gordian knot and go to a single-payer system. So if I could be persuaded that this was actually feasible, I'd put my politics to one side because, like I said to the two co-sponsors, what my mind immediately zeroed in on was that 20 million savings for the city of Fitchburg. If I think that's actually realizable, that it's actually going to pan out, how could I put my own political preferences in the way of that? The city desperately needs it. But the bureaucratic issues and, as Chairwoman Walsh mentioned, the problem of buy-in from the federal government, which for at least the next 3 years seems highly unlikely, means that I worry that we would pass this law and then be left with much the same situation as the ACA rollout, where, the actual implementation took years to work out some very serious kinks that were, that made it worse than the alternative in the short term. And we, especially here in Fitchburg, can't afford worse than the status quo, even in the short term, in exchange for long-term benefit. So at the current time and in its current state, I'm going to have to vote against this. But I do appreciate it being brought forward. And like I said, some more troubleshooting, some more, maybe a new administration that might, at least in theory, cooperate with the state on this. And I might very well have a different take on this next time it comes up. I am by no means closing myself off to this or saying, this is a bad idea. I just can't quite get past the practical details at the moment. I yield the floor.
Councilor Van Hazinga.
Thank you. I also have concerns and questions about whether or not we can make this work. But I do think the goal is worthy, that our current system is broken. It is not equitable, it's not fair, it's not sustainable. We do need to change something. And if passing a non-binding resolution endorses the idea of that we need to work towards a solution, then I will vote for it. I don't think all my questions are answered, but this is, again, a non-binding resolution. I'm just expressing my support to the effort to find a solution to a significant problem that we have, because we do have to change things. And we cannot continue the way we are going. So I will support it.
Councilor Kuchar.
Oh, thank you. I want to echo what City Council President Zarella said, but I also wanted to add that I also added a more of a personal note to this, because I have relatives in Canada. I also have some relatives in Europe. I reach out to their single-payer system. Canada says, you know what, we get denied all the time. All the time. And we got to go back. We got to keep going back. We got to keep going back to try to change the bureaucrat's mind. I just don't want to see that here in Massachusetts. I certainly don't want to see it here in Fitchburg. So I yield the floor.
Thank you. I think at this point, I'm just not convinced that the feasibility is there. I agree with Council President Zarella in that regard. I would love to see this go, happen and work well. I just don't have enough information. I think there's a lot of missing information. And before we take that leap, I would like to know what we're jumping into. I'm going to ask for a motion.
May I, because there has not been a motion, may I say it looks like the writing's on the wall. I would encourage a motion to withdraw instead of a formal vote.
I'll make a motion to give leave to withdraw.
Second.
All in favor?
Thank you.
Aye.
Any opposition? Okay. The resolution is given leave to withdraw.
Thank you.
Motion
That
to
is-
adjourn.
Second.
We are adjourned.